So this video, we kind of tie everything together from Wiggers. We're going to talk about the cardiac cycle. We're not really going to get into Wiggers, but hopefully you kind of just see a big overview here. So with this, we've got two primary outcomes. So first we're going to talk about blood pressure. We're going to talk about systolic and diastolic blood pressure. For both of these, you need to know the cause and the timing. Okay, so systolic blood pressure is pressure in the arteries during contraction of the left ventricle. That's the when. The why is the pressure occurs due to blood leaving the ventricle. This causes the arteries to expand or balloon out, which you can see from this figure here. Systolic blood pressure is the maximal arterial pressure that we experience. This is the 120. Then you've got diastolic blood pressure. The when is when the left ventricle relaxes. Okay, so there's not blood coming out of that aortic valve, and so now the arteries are able to recoil. That recoil is what is what causes the pressure. That recoil is what causes blood to continue flowing even when the heart's relaxing. The reason that this is bolded is because this question will be on the exam. What causes diastolic blood pressure? Okay, it's not the relaxation of the left ventricle, it's the recoil of the arteries. Okay, and this is your minimal arterial pressure. This is the 80. Okay, so here we've got the Wiggers diagram, and so as you can see, that red line, that's aortic pressure, and then the green line, and I know that those are not the best colors, okay, but basically notice that ventricular pressure barely exceeds aortic pressure. We just need ventricular pressure to just be a little bit above aortic pressure so that the semilunar valve, that aortic valve, is open. Okay, and notice that at its minimum, the aortic pressure is about 80, and at its maximum, it's about 120. Okay, that's where we get 120 over 80 from. So typical pressure, systolic 120, diastolic over 80. I pounded that, beat a dead horse on this video, but there you go. Now, when it comes to the right and left ventricles, they're the same, but they're different. Okay, the volume of blood that enters and leaves the right and left ventricle at any given time is about the same. If you go over a long period of time, it will be the exact same. Otherwise, you're going to empty one and fill up the other. Okay, so what goes into the right side of the heart must enter and then leave the left side of the heart. So what are some differences? Well, the right side pumps blood through the pulmonary circuit. It's just got to get it through the pulmonary artery, capillaries, and veins. Okay, it doesn't have to travel very far. The left side has to get blood out through the aorta, down to my big toe, back up to my heart, and then blood from my aorta up to my brain, back down to my heart. Okay, so it's a lot different of a difference. Diastolic blood pressure, so that's the pressure when the ventricle is relaxing in this case. Okay, but pressure in the ventricles is about the same. Okay, it gets really low. However, the systolic blood pressure is very different. The right side pumps at about pressure of 20, whereas the left side is pressure of 120. So what's the difference? Why do we have such big changes in pressure? That's 6 times. Well, flow's equal, so that's not the issue. And so pressure is not. So if you go back to the relationship, or if you look at the relationship between flow and pressure, the other variable that's affected is resistance. The left side of the heart must overcome greater resistance. And so there are a few things that make it so that the left side of the heart has to pump harder. There's longer vessels, there's more vessels, and we're dealing with gravity, right? The right side of the heart's just got to get blood into my lungs. That's right here. Right side. Left side, got to get blood from my big toe. That's a long ways away. All right. And we'll talk in more detail about how resistance affects pressure and about how these factors affect resistance. So at the end of this video, can you do these 2 things? Can you define systolic and diastolic blood pressure? And so when they occur and what causes them to occur? And then can you describe the differences and similarities between the right and left ventricles?